My name is Tiffany Alley, and I am currently the Chief Resident at the Department of Pathology. I think one of my favorite days of the year is actually Match Day. I'm always excited to see who is going to come into our family here at the Department of Pathology. I'm that excited because I know the environment. I know how well they're going to do here, and I especially am thrilled to be able to interact with individuals who share a common passion. One of the things that I truly appreciate about our program is the graduator responsibility over the years. Initially, we were very much guided through the process, both from the faculty as well as the other residents. I found the transition to be rather seamless. With some of the more complicated cases, I really feel as though I have a greater sense of autonomy where I am allowed the space to address the case, to really get into the case and treat the case as though in the end I would be signing it out. So that's always great, and especially when you go in and you're sitting with your attending and you've nailed it and they can turn to you and say, you know what, you did a great job. So those are the days that are really amazing here. Other things that come to mind when I think about highlights are the interactions that you have with the other residents. We are a very sharing group here. If somebody has an amazing case, they are going to share it with the entire group. We have opportunities to sit down together at the scope to discuss these various cases, and the other residents are also there to support you when you're struggling with a case, maybe struggling on a personal level. I never feel alone in this atmosphere. To me, our program stands out because although it is one of the smaller programs that you will find, it is not small with regard to caseload. I feel as though we are always working at 110% capacity, and that gives us the ability to see a wide variety of cases. And we provide some of the most excellent patient care sort of behind the scenes. Myself and the other residents have opportunities to engage in interdepartmental research that allows us to understand the various aspects that go into providing the best health care for our patients. Having come from a large city and living in a variety of larger cities, I was a little bit hesitant to move to Eastern Tennessee. The transition was a little bit rocky at first because I was so used to that, gung-ho, get from point A to point B. But as I became more accustomed to Knoxville, my views have completely changed. I have found myself to be much more relaxed. I have the ability now to look around, and I get to look around at an amazing landscape here. If given an opportunity to move back to a larger city, I would have to say no. The cost of living here is absolutely amazing. The commute, better so. I think one of the easiest decisions I've ever had in my life was choosing to be here at the University of Tennessee Department of Pathology. I was initially greeted by the resident coordinators in the hallway, and they immediately made me feel like I was one of the family, even though I do not believe that was their intention, but they are so warm and inviting, and that feeling did not end. Upon doing a rotation here, I found that even the residents sort of wanted to engage you. They wanted to bring you into the fold and have you participate daily. When it came to ranking my choices, I made the choice to rank one and only one program because I truly felt that this was the place for me.